Good day to you. This is the third lecture of the series of lectures on management. Now, we looked at the lecture 1, definition of management, and we looked at the strategic planning. The second lecture, we looked at the operational planning. Today, we are looking at the organizing part of it. You have planning, organizing part of it in the management process. In the organization part, the main component what we do is we will allocate resources in order to get the management process done. So look at what are the main resources you need. We spoke about it in our some time ago. Infrastructure you need, facility management, human resources, equipment, supplies, methods, and information. So what are the unique features of the resources used in healthcare? One thing is infrastructure. It's a cost of the building, very expensive cost. It's a very complicated services that you do, right? Not only one, you have theaters, ICUs, etc., oxygen. It's very complicated. Then the clinical needs of the infrastructure, the proper walls, the antimicrobial stuff, infection control techniques, all that, and even the air conditioning, And there's a multidisciplinary staff working in this. Different types of people, but at the end of the day, you're really looking at the patient care. Then maintenance, you have to maintain these things, very expensive maintenance, right? And then asset utilization, this I spoke to you, right? Space versus the work environment. How much of space you need in order to do things. Now, for example, now COVID has changed the whole world differently. We don't know whether we can run hospitals anymore because with the distancing and all that. But primarily, we looked at the control of infections. We look at the infection control, other methods, hand washing, keeping places clean, etc. And health and safety of the patients, right? So, and the staff as well, right? What are the things? Look at these areas, very important areas, right? And civil and mechanical and engineering areas, right? What are the building management, right? Services, and then need to have a good knowledge of a medical administrator or the nursing administrator or the nursing in charge who have a better understanding how to manage the infrastructure, right? And then look at the human resources. Demand for human resources. Now, if you look at the manpower is the most expensive in the hospital. Now, we spend more than 40 to 60% of our expenditure is on the human resource, right? And then we have a large number of categories, starting from the cardiac surgeon to the boatman. Now, Delft Island, they have to go in a boat. There's a boatman category also. There are about nearly 200 different categories, 180 to 200 different categories in the health sector, right? And how can you use the best use of the existing manpower? How will you use them? Then it says, right person has to be there. That's a recruitment. They should do the right job. That's a job design. I'll talk to you what job design is. Right quantity, not right enough. You have to forecast the number that you needed. Future forecast has to come in. Then the right quality, they align with the organization culture and objectives. So these are the things in a proper HR management. Now, we do a short-term management, right? Then you a long-term management. So definition of HR management, human resource management is the acquisition, development, allocation and utilization of the manpower efficient and effectively to achieve the organization goals and objectives. Acquisition, development, allocation and utilization. So generally there are policies in the organization. Our state sector has a policies, private sector has policies. Then if you are expanding in future, expansion in forecast now, as an administrator, I can remember sometimes you expand the hospital without looking at the training needs. Now in Sri Lanka, there are a lot of ICUs idling with the equipment, with the infrastructure, due to lack of ICU trained nurses. So then you look at the employee market. Some people go out of the country, some people go to the private sector, right? All that. And then look at the hospital other variables. What is the general shortage at the specialized skills, as I told you before? And it's very expensive. The training is expensive, and you have to have short-term and the long-term training. Then some of the hospitals, the clinics will then specialized skills, specialized hospitals. Then if you change the hospital structure, you need different people, and depending on the policies of the hospital. And then technical advancement, because you have to now most of the equipments now, there's not machines, but there are a lot of softwares. So what is the IT knowledge of these people? What are the skills of new skills that they need, right? The categories, right? And there's global pressure for all the nurses to be in par with world standards. What are the regulations? Labor regulations, what we have, health ministry regulations, right, or the other private sector organization regulations. They look at the medical, nursing, and other council registration, accreditation bodies, WHO, organization policies, right? So, objectives of general human resource planning is to utilize them well, assessment of the input, anticipation of the output, and you can read this slowly. Now, this is a human resource process. You forecast the future requirements, then look at from where you can get it, and then use the maximum of this human resource, and then training and development. Then there will be resignation, retirement and discharge and transfer. You have to really look at this. When you are looking at the hospital environment, the unit design is very important. We have to look at the unit design is what is the human resource structure of the organization, how many needs, and what are as per the standards of the hospital. And then how many, what's the qualify, what's the skills that they should have, quantify how many numbers you need. It's called a job design. And then you organize the HR policies. If you look at the unit design, the unit has to be the HR, the nurses, let's say, take nurses, should be agile. They should be able to move into agilities, move into, one could work in the theatre, then other times less, the non-theatre hours, they should be able to work in the OPD or any other department, agility. Then the lean, you should have many people there. So it's a fat structure, right? They might not be able to do fat structures are not good for hospitals. So you have a lean structure. Then faster patient process. How can you support to get the throughput of the patients, right? Safety and minimum risk for the staff and the customers. How can you do all this? That's your need design. And then you put up the HR standards. Now generally a ward would have 6 to 1, 6 beds to 1 patient, right? This 6 beds to 1 patient, and specialized ones, 1 to 1 like ICU, right? Then how can you look at the then you go into look at the job design, right? Job design is a person sitting in a one position. What are the knowledge that they need? What are the skills that they need? What are the aptitude that they need? Attitude that they need? That's a design. It's knowledge, of course, the qualification that they have, the training that they have, skill, the experience that they have, aptitude, they are the orientation, their positive attitude towards work, right? And then aptitude is the expandability of a person, how much of a potential that person has to take up a different the different level. Can a nurse in the medical department, can she be the in charge? All that. So we generally if you can read this to make a job design, you have to analyze the job first, right? You look at what are the scope of work that they do need, then you write down this thing in a job description, and then you specify exactly what they're supposed to do. This is called a job design. Then we look at the equipment. We spoke about the human resource, then we look at the equipment. Now equipment is very expensive. There are medical equipments and non-medical equipments like furniture and then the ultrasound scanner. They are very capital intensive in nature. That means they will have to spend a lot of money to buy them. And they are very expensive. And lifetime is, there has a lifetime, 5 years, maybe 3 years for a ECG machine, maybe sometimes seconds in some of the pulse oximeters, etc. If you drop it, it's gone. So therefore, they need to replace, right? And then there's software and hardware. I spoke about it. And then handling is very important. Training is important. And the utilization, how much you utilize these machines, and then the forecast. And then you need supplies to run a machine. You need sometimes chemicals to run. Then maintenance and service agreements, because most of the time you really have to, when you buy a machine, or even a donated machine, ask for a service agreement. Otherwise, generally, it's very expensive, the service agreement, and you have to maintain. Otherwise, if the machine breaks down, your service is going to interrupt it. So you have to stop that happening. And look at the lead time. When you're ordering equipment, you can't just buy over the shelf. There's a lead time. There's a time that they take to manufacture and give it. And this is handled by agents. It's a complicated industry. You should make sure nobody is taking a buck out of it. You have to really make sure transparent process when you buy equipment. Then the supplies. You look at the supplies, there are medical and non-medical supplies. Look at the cost of each one, and then the quality of the supplies that you get, efficacy, how much is working, how much evidence-based, right? And then look at storing and expiry date, estimation of the forecasting, and the management of the supply chain. You look at all these areas when you try to do that. And then if your best is to, in a hospital, to develop a formulary, a list of drugs, right? What we do is, once you have a list of drugs called formulary, then that gives a reference to prescribers. Also streamline the range of drugs. You can just have 1,000 drugs. You can have about 500, 600 drugs. And then you only store the drugs which are useful, right? So these are the things. A formulary, quality patient care at affordable price, reduce the inventory holding cost. When you have store a lot of money, lot of drugs, it's a lot of inventory that you are holding, and then reduce the storage space also. Think about it more and more, and then reduce the chances of medication error. So I'm going to do a little bit of more on this because you deal with this basically. What we do is we have a list of pharmaceutical drugs in a formulary. It's reviewed periodically, annually, and then monitored by the pharmacy manager, and you are also part of it. So you can include the new pharmaceutical or delete the previous ones. It's regulated by the drug committee and distributed to medical and nursing staff formulary that we categorize on the therapeutic class. Generic names are displayed. Dosage forms, dosage guide, abbreviation, short forms will have to be there if you are looking at it. Now, basically, the list is approved by the drug committee, stocked by the pharmacy, available for you to use it, including nurses. So there are non-formulary drugs which are not in the formulary, not reviewed by the drug. So generally, we do local purchase and emergency only we will use them. And then when you look at the selection of drugs, we have to really look at the need of the drug, efficacy, risk, and the cost. The need, if you look at it, the need versus wants. Now, some doctors or somebody wants those drugs. The need is you just use the generic drugs, right? And then is it really needed, right? Efficacy in treating and its condition. Can you use any substitute, cheaper one, right? And then any vested interest to the prescriber, we don't know. But we will have to really ignore these things and make sure the cost effectiveness. Then the efficacies, evidence-based medicine. What is the best drug for this thing? The COVID crisis, they came out a lot of stories. They came with primaquine, chloroquine, this and that. Ultimately, what is the evidence says, right? And the risk, side effects, adverse reactions, patient acceptability, and the ease of administration. As you nurses, this prescribe what is the best mode of storage. Any special storage requirement you need, cold storage. Those are expensive. How can you use the drugs which you use for mainly room temperature, and the cost of the drugs, also the efficacy, relative drugs in the same drug class, right? Cost to the hospital, acquisition cost to buy. If you have in between a broker, you should agency might have a lot of money in between, then the cost will go up, and the long term and short term duration. So tip for better management of formulary. This an area you can look at as nurses. One thing is, in addition must be come with the deletion. Avoid duplication of the same drug class. Do not keep multiple strengths. You keep as minimum strength. You can break it and give it if you can. Avoid drugs with a similar packaging because they might have a risk in giving the wrong drug. Frequent drug utilization and surveillance is very important. And beware of manipulation by prescribers, and don't afraid to say no. Less bulky packages. You get less bulky packages. You can store them. Then best that you take drugs which are stabilized at room temperature and less likelihood to break. Plastic causes this thing, and then possibility of break dosage and multi-purpose, right? And then patient-friendly packing. Let's go for methods that we use. As I told you before, one of the resources that you need is the policies and protocol as an input to the your management process. Policies and protocols, strategic long-term objectives, short-term objectives, and the hospital and the unit and the standards. You have the national standards, you have international standards, there are life-saving standards, there are the cost-saving standards, then monitoring and feedback. Those are the important ones. Then we go into information management, right? We have a hospital information systems called HIS. And what are the uses of hospital information systems? And HIMS is a hospital health information management system. PHIS is the public health information management system. And there's a support service care. Now, people will look at the hospital management system, only the clinical care. No, 60% of the care is on support service care, which I told you before. And then the clinical service management about 40%. And then monitoring mechanisms. And how can you use this information for future planning and forecasting? And that will be useful for quality and financial audits. Then I've just mentioned on facility management before, and then similarly, you should look at these areas.